Welcome to the second in the series of the immune system, lymphatics. We're going to talk about the lymphatic system as a whole and what the lymphatic system actually does, what the physiology is as far as immunity, fluid removal, lipid absorption, then going through some of the structures, and I'll go through a couple cases. All right, so let's look at the first medical scenario. You step on a rusty nail. Luckily, you're up to date on your tetanus vaccination. Your first responders, and I'm referring to first responders as those elements in your blood that are first to arrive to the scene of the nail stick. Our first question, how do first responders, the neutrophils, etc., move from the bloodstream to the actual site of infection? Is it first by osmosis, diffusion, or through capillary pores? And the answer is they do this through capillary pores. And here's a video showing a depiction of the blood moving through the bloodstream and these white blood cells being capable of migrating through those pores into the subcutaneous tissue. The first responders, if you remember, are the neutrophils, basophils, macrophages, dendritic cells. And then if there are activated lymphocytes, they would be there as well. So all of this action initiates a swelling and a inflammation where the blood vessels dilate, allowing even more white blood cells to get into it. But in addition, what happens is that plasma goes through into that site of infection. So the large particles, like the red blood cells and proteins, don't pass through those capillary pores. White blood cells do pass, and then, of course, those first responders. Next question. What keeps all the water and salts from plasma leaking out into the capillaries, into the tissues? How is it you're able to keep any intracellular fluid inside your capillary network? Is it the red blood cells? Is it albumin? Or is it your blood pressure? And the answer is it's the albumin, a protein that floating along in your capillary network and all throughout your bloodstream as well. Albumin's extremely important. It's produced by the liver. It's a carrier protein for insoluble proteins like hormones. Cortisol, testosterone, estrogen are all examples of hormones. They're being carried by albumin. And albumin also has the ability to attract sodium. And when it attracts sodium, water comes as well. So it's this albumin that's able to keep much of your water from leaking out of the capillary pores. So this is showing albumin being created by the liver, transportation of hormones, fatty acids, and it's also keeping circulating blood volume. Let's do another scenario. A 67-year-old man has open heart surgery. So he's in the operating room for quite a long time. It lasts 6 hours. And during that process, he received several liters of salt solution, but no blood or albumin. Now, in the hospital, the reference to saline or salt solution is called crystalloid. Reference to a patient receiving blood or albumin, they would call that a colloid. So in the intensive care unit, he's got subconjunctival edema. This is that swelling beneath the conjunctiva of the eye. And then peripherally, all throughout, patient looks like the Michelin Man. It's got swelling, pitting edema. And pitting edema is these impressions that you see when you press, your thumb or your finger, you press into the tissues right here. And pitting means that after you've pushed down it, it doesn't come back very quickly. Okay, so too much water has been driven into the tissues. What has caused this? Is he in heart failure? Is he in kidney failure? Or does he have low albumin concentrations in the plasma? And the answer is this patient has low albumin concentrations in the plasma. Peripheral edema can also be caused by heart failure and kidney failure, but in this scenario, it's because he had all this crystalloid in the operating room. The medical term is called dilutional hypoalbuminemia. And this may be due to aggressive treatment of bleeding or patients getting large amounts of crystalloid or the salt solution that are used as a blood replacement. Now, this does resolve in roughly 24 hours, and it resolves because of the lymphatic system. And this is how swelling from a cut or even a bee sting, this is how that edema also resolved, is through your lymphatic system. And I'll show, if you look at this little image here, the green is a depiction of the lymphatic system. It's going all throughout the tissues, including the skin, present at all these capillary beds, except for the brain, and we'll go through that in a minute. But it's picking up all that excessive fluid, and it also picks up pathogens and takes it into the lymphatic system. So the many capillary beds in your body, just going through several of them, are the lymphatic system that involves the waste cleanup, immune response, this at the capillary level of your tissues. Then you have capillary beds, of course, the alveoli and the lungs, and that's for the gas exchange only, oxygen and carbon dioxide. Then the other capillary bed that we'll be getting to in the urinary system is this capillary network in the glomeruli, in the kidneys. And these are only found, of course, in the nephrons in the kidneys for filtration of blood. And as opposed to these other capillary networks that go from artery to vein, here it switches artery to vein or arterial to venule, the glomeruli in the kidneys stay arterial. But we'll go into that more when we get to the urinary system. So the lymphatics pick up all that excess water, they pick up pathogens, toxins, and they do that between the cells. And there's a depiction again of the lymphatics between tissue cells. So I referenced the brain a moment ago. When does the brain clean itself of metabolic waste? And by the way, this is the only time your brain cleans itself. Is it during exercise, during deep sleep, or during REM or rapid eye movement sleep? And the answer is it's only during that very, very deep part of sleep. So look at this depiction of the lymphatic system. The body's lymphatic system does not extend into the brain. The lymphatics you see here around the head are going around your face, your ears, your eyes. You notice you get an ear infection, you get some cervical lymphadenopathy. But this is not inside the cranium. So it's only during this very deep sleep. And the other term is NREM or non-REM sleep. The brain cells shrink. And during that period of time, cerebral spinal fluid passes between those cells and takes the CSF to a capillary network that dumps into the venous return going back to the heart. So the capillaries in the brain are surrounded by astrocytes. This is going back to the nervous system. And those astrocytes surround the capillaries and they seal all of the capillary pores. So this is the way the brain prevents swelling, since there's no room for expansion in the cranium. It also helps with pathogens from entering into the brain. Okay, so let's go to disease presentation. This is called lymphatic filariasis. And this is where a parasite gets into the lymphatic system, and then it reproduces and it blocks up drainage of the lymphatic system. So it's carried by a mosquito, and it's generally in places that have this parasite. And this is what it looks like, where one extremity, in this case it's the right leg, it's physically blocked. The lymphatics are physically blocked, and the other side is functioning normally. And the term you hear is called Elephantiasis. The treatment is antiparasitic, and this is one example, ivermectin. If any of you have horses, you might treat your horses for parasites, and this is the same medicine that can be used to treat filariasis as well. Next question. There are two systems we've been talking about, the circulatory system and now the lymphatic system. Which of these systems run in a continuous loop? Is it the circulatory system or the lymphatic system, or both? And the answer is it's both. Actually, excuse me, I'm sorry. Sorry, it's only the circulatory system. The circulatory system goes continuously, and it has to. If it doesn't run continuously, you'll start developing blood clots. Lymphatic system does not have platelets in it, so it can go in one unidirectional or one single direction. Okay, so blood circulation circulates, makes a circuit. Lymphatic flow originates at a capillary bed. This is showing just a couple capillary beds, the upper extremity, lower extremities, and then it ends at an entrance to the venous circulation. These are the two places of insertion into the venous circulation. The lymphatic fluid is called chyle. It drains in from the right upper extremity in the blue, depiction of the blue, into this bifurcation of the right internal jugular vein and the subclavian vein. And on the left side, it gets a special name. Instead of the left lymphatic duct, it's called the thoracic duct. It gets this majority of lymphatic drainage throughout the entire body except for the right upper extremity. So it's getting all the things around your abdomen, peritoneum, GI tract. So there's so much that's coming from the GI tract that there's actually a collection point right here in the thoracic, right, the thoraco-abdominal vertebra. And this collection point is called the cisterna chyli. I remember that because a cistern is a collecting tank. And it's collecting chyle. So it's a cisterna chyli. So this chyle is a milky fluid. It contains lymphatic fluids, free fatty acids, and then of course some potential toxins. Okay, let's do a case presentation. This is in a low resource setting. This is a little 6-year-old girl with left-sided neck swelling. She's got a soft mass, but there's no pain. It's very soft. Right here. The diagnosis is called a cystic hygroma. So this is a congenital weakness in the lymphatic sac where it dumps the lymphatic fluid into that thoracic duct on the left side. And this is actually in the operating room. And this shows how massive this duct is. It's normally not that big. Here's another one, a cystic hygroma of a 1-month-old infant. The baby was not having problems breathing, so it was decided to wait until the child was a little older. So all of this is lymphatic drainage. So there's a blockage in one of the lymphatic drainage sites. Next question. Lymphatic fluid, otherwise known as chyle, is white. Besides containing lymphocytes, what makes it white? Here's a hint of a bottle of milk. Is it the lipids, the sugars, or proteins? Answer, it's the lipids, and that is so totally wrong. I am so sorry. Sometimes when this reverts over, the red mark goes wrong. It is actually from lipids. So digesting a cheese stick, for example, breaks down the lipids, transfers this into the bloodstream, and carries it to the liver to make something useful for your body, like cell membranes. So the lipid utilization is the breakdown of fats, then it's carried by the lymphatics to the circulatory system, and then it finally gets to the liver. So when you eat, and we'll get to this more in the digestive system, but in the duodenum, the lipids are reduced to free fatty acids and monoglycerides. So all of this happens here in the duodenum. So the fats go all the way through the stomach, and then the digestion for the fats is starting in the duodenum, along with bile and amylase. The pancreatic enzymes break down lipids, lipase. And then what happens after everything is broken down in the jejunum and the ileum, is the absorption of fatty acids into the lymphatic system. So these free fatty acids are getting to these little lacteals. These are part of the lymphatic system. So this is the intestinal lining, the villi, and all these little free fatty acids are getting into lymphatics. Okay, so I'm going to go through another couple lymphatic structures that are clinically significant. So along with the lymph nodes, there's a spleen, the thymus, and of course the tonsils, the tonsillar tissue. So, and also the omentum, that in fact is considered now organ in and of itself, and it's also part of the immune system. And there's actually a greater and a lesser omentum. And the way to remember that is the lesser omentum attaches to the lesser curvature of the stomach, and the greater omentum attaches to the greater curvature of the stomach. So the attachment is here, and this acts like an apron that hangs over the intestines. One of the reasons to tell you about this is that during C-sections, when a patient's like under a spinal anesthetic block, the surgeon might pull a little bit on the omentum, and that will actually cause referred pain, and they'll feel it in the shoulder. And that word, spinal anesthesia block, that should be a B. So the omentum, otherwise, looking like an apron, is also called the policeman of the abdomen. Because you'll find that when someone has appendicitis, after it's ruptured, the omentum will actually kind of form a seal around the site or the abscess site. So the original pain with appendicitis will be, for instance, in the right lower quadrant. And after a while, after this infection starts to grow, patient's pain will start being referred now to the umbilicus and to the whole abdomen. And within this omentum, there's actually dendritic cells, B, T cells, macrophages, all of this. Okay, so let's go on to the tonsils. And you actually have three sets. You have these adenoids, and you can't see these, but these are in the very back of your nose. Notice how close those adenoids are to the eustachian tube, which is the opening to your middle ear. So when someone has an adenoidectomy along with a tonsillectomy, they'll have those adenoids removed. The palatine tonsils are the ones that are taken out. What remains are usually those lingual tonsils. So when someone says, I've had my tonsils taken out, but they grew back, they're probably just referring to the presence of those lingual tonsils way back at the base of the tongue. All right, so a case presentation or example, medical scenario. This is tonsillitis. And you can tell that it's bacterial in origin because you see this white exudate. And that's because of the presence of these first responders or white blood cells. And the treatment would be antibiotics if it's clearly bacterial in origin. You could get a swab and check. Now, this is another medical scenario. This is tonsillar hypertrophy. And you'll notice the tonsils have these crypts. If you can see them in this image. And sometimes you can get these little concretions that develop in there. So there's a couple reasons for tonsillectomy. One is if these tonsils are huge and they're actually obstructing breathing during the night. really noisy breathing in a child, very bad behavior at school, they're not getting good sleep, that's another indication for a tonsillectomy. Okay, another medical scenario. Your 3-year-old nephew has enlarged palatine tonsils and adenoids. One day he presents with fever and is pulling on his ears. He's diagnosed with a middle ear infection. Okay, look at this image. What structure is blocked off by these enlarged adenoids? Remember, these are in the very back of your nose, the ones you can't see. Is it the external auditory canal or the eustachian tube? The answer is the eustachian tube. Remember, the middle ear drains into the very back of the nose. And if that gets blocked up, any kind of bacteria that's up in here is not being drained, not being open to air, and that'll just form an abscess cavity and start an infection. The eardrum will swell, and it's that swelling of the eardrum that causes the severe pain. And the external auditory canal is the opening to the pinna, the outside of the ear. So enlarged adenoids block the eustachian tube, the middle ear can't drain, and the trap bacteria multiply. And just to go over it one more time, inner ear is this location, cochlea, vestibular apparatus, these nerves, cranial nerve 8, middle ear, external ear. So to summarize, the lymphatic system is not a circuit. It's a one-way system, dumping all that fluid back into the venous circulation. It's part of your cleanup system for your immunity. It's also for lipid transfer to get the fatty acids that have been broken down at the site of the duodenum and transported to the liver. And of course, lymphatic tissue, we talked about the nodes, the tonsils, and of course the omentum. So remember chyle, the name for lymphatic fluid. It's broken down lipids, potential pathogens, and of course there's some white blood cells in there as well that aren't hanging out in the lymph nodes. And this is just a depiction showing part of the ileum, and a smaller version, all these villi, and then broken that down further is this lymphatic system. It's going into the villi to pick up the free fatty acids. So quick quiz question. The breakdown products of fat need to get from the lymphatics to the bloodstream. What is that access point? So this is only for fat. The right answer is the thoracic duct, the left side. The clinical significance is that if you're doing a needle stick, like a right internal jugular vein needle stick for central venous access, right there at that point, and that's happened to me before where I've put a needle in and drawn back milky, bloody milky fluid. You've gotten into the thoracic duct. Of course, the lymphatic tissues include the lymph nodes, and I included these things called Peyer's patches because they line the intestines, another defense for what you're eating. Tonsils, entrance to the respiratory system and GI tracts, and the omentum or the policeman of the abdomen.
The thymus and spleen, along with a network of lymph vessels, ducts, and nodes, form the lymphatic system that protects the body by removing pathogens. Tissues in the body are surrounded by lymphatic vessels and capillaries of the circulatory system. As water and substances are exchanged between tissues and the bloodstream, unwanted substances enter the lymphatic network and travel towards nodes. Groups of lymph nodes are located at the axilla, groin, neck, and in the intestinal region. The nodes are filled with lymphocytes, the body's defense cells. These cells support immunity by eliminating pathogens that can cause infections. Clean lymphatic fluid travels towards the thoracic cavity and re-enters the bloodstream.
All right, so that's a visible body summary. Any questions? Please leave comments and stay tuned for the next installment.